Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, we are running the series Ayurveda in GP. Ayurveda is in general medical practice. Today's topic is per rectal bleeding. Actually, you must understand some basic concepts from Ayurveda also, that whenever there is a bleeding, which is called as a Raktastrava in Ayurveda, there is a role of Rakta Dhatu and Pitta Dosha. Remember this, Pitta Dosha and Rakta Dhatu. So the basic reasons as per Ayurveda, whenever the person takes Pitta Prakopak Ahar Vihar, by which food or the lifestyle Pitta gets vitiated or Prakupita, then that can damage the Rakta Dhatu, and then permeability of the capillaries get disturbed, and there may be bleeding from the upward side or the downward sides or on the skin level. My dear friends, Ayurveda, if we compare this topic in Ayurveda, it can be compared with Rakta Pitta disease. This is blood dyscrasias. It can include so many entities. For example, whenever there is a bleeding from upward part, that is called as a Urdhvaga Rakta Pitta in Ayurveda. From bleeding from the downward parts, it is called as a Adhoga Rakta Pitta in Ayurveda. When there is a skin manifestations, it is called as Tiryak Rakta Pitta, for example, ecchymosis or purpura. Whenever the bleeding comes through the sputum, we call it as a hemoptysis, which is mainly because of the tuberculosis. When it is coming from the vomiting, that is called as a hematemesis, especially in the esophageal varices. Whenever there is bleeding from the nose, that is called as a epistaxis, because of the fragility is increased of the nasal capillaries, especially it occurs in the summer season. Now, from the downward parts, for example, when the bleeding is through the urine, it is called as a hematuria. Whenever there is excessive menstrual discharge, that is also a part of Adhoga Rakta Pitta. Charaka text is very important for the management as per Ayurveda. There, the principle of Rakta Pitta is Pratimarga cha Shodhayat, Pratimargam cha Harayat. That means if there is a bleeding from the upward side, the patient has to give the Virechana Chikitsa, that is therapeutic purgation. Whenever there is a problem from the downward passage, that is Adhoga Rakta Pitta, then if the patient is having strong body built up, then we can give the as per indication Vamana Chikitsa, that is therapeutic vomiting. So now we will start to talk about this per rectal bleeding, but before that, let me clear that what is Pitta Prakopak Ahar Vihar, food stuff and lifestyle. Pitta is basically fire. So Ushna, Tikshna are the properties. Hot and heat is the prime important properties of Pitta dosha. So if you eat lot of spicy things, pungent things, green chili, then spices, kitchen spices, and then the red chili, the tamda rasa of the Kolhapur in Maharashtra, vada pav and the chilies with that. So pickles, lot of pickles, chutneys. So these things can provoke your Pitta dosha, and that can damage to the Rakta Dhatu, and you will not stop the bleeding pile complaint unless and until you stop eating spicy things. But this is not enough. Even if your lifestyle, if you are working near the furnaces, near the fire, in the hot climate, then that is also provoking the Pitta dosha. Then you have to give such a management that it will Pitta Shamaka treatment is very useful for this any type of the bleeding, especially per rectal bleeding. Another thing, we are having the different tests. For example, Madhur, Amla, Lavana, Katu, Tikta, Kashaya, sweet, sour, salty, pungent, etc. The bitter test, and especially the Kashaya's test, that is the astringent property, is very useful to control the bleeding, because astringent properties cause the vasoconstriction. I am giving you the basic principles of Ayurveda. Try to understand. Even your psychological temperament, you are very angry and hot-tempered person, that also can affect the bleeding problems. It will not be get cured only because taking some tablets. So be careful about all these type of holistic management of Ayurveda. Now let us start the actual topic, per rectal bleeding. So first I will discuss about the etiology, that is causes, and then we will some have investigation and the Ayurvedic prescriptions. So these are the all etiological factors. I am always marking this screen to make a concentration on that topic. So painless rectal bleeding. Bleeding is there, but no pain is there. Then in children, there may be rectal polyp. There may be rectal prolapsed and intussusceptions. This is going into each other. That is called as intussusception. Then piles, that is hemorrhoids. Cancer of the rectum may be painless bleeding. Remember this thing. And amoebiasis, parasitic infection. Then painful rectal bleeding is basically three reasons. Fissure in ano, perikartika in Ayurveda, perikartika. Then perianal hematoma. Then abscess. These are the painful rectal bleeding. Okay. Now let us talk about the one by one the problem. So first thing about the rectal polyp, basically this patient has to be referred to a surgeon or a specialist. Then rectal prolapse, insert prolapsed rectum inside manually with the sterile gloves and all these things, and you have to give the bandage with the having chukra tail or mushak tail. These are very rare. You will not get these oils very easily in the market on Amazon. But you have to go to the nearby Vaidya and he may prepare for you this particular type of the oils, chukra oil or mushak oil for lubrication. Make a tight bandage with above said oils over the rectum. Find out the cause, and more often this is a loose motion, treat the basic disease very properly. Now for the rectal prolapse, do not force yourself for evacuating the bowel. No straining, no pravahana in Ayurveda. Don't do that. That can increase the prolapse problem. In Ayurveda, it is called as a gudha bhransha. Gudha bhransha, rectal prolapse, taking out. Okay. Do not suppress the natural urges for micturition or going to the stools, that is defecation. Do not stop this. Navegandharyet, vata, wind, mutra, kshavatritchudam, nidra, kasa, shramashvasa, jurumba, shru, chardiretasam. Bhagavad has said 13 natural urges should not be created artificially or should not be suppressed. The main urges are urination, defecation, hunger, thirst, and sleep. Don't forget these 5 important natural urges. Don't suppress it, please. Then we will go further. This is about the piles. In Ayurveda, it is called as a arsha. Arsha. It may be raktarsha or it may be shishkarsha. But we are talking about both the things over here. First is a dry piles. There is a different medicines for the bleeding piles and there is different treatment for the dry piles. So what is the treatment? Here you can see the best treatment is like this. Kankayana Guti available on Amazon with Vaidyanath, 2 tablets 3 times in a day. Trifla Gugulu, 2 tablets 3 times in a day. Then get a normal stools without any straining. Hirda is the best, Harad is the best. Abhaya Rishta, 4 teaspoons with equal amount of water 2 times after lunch and after dinner. Now next prescription, my dear friends, Dr. Deshpande is sharing knowledge and experience with the different prescriptions. Kutajat, Vaidyanath or any Kutaja Ghanavati is also available. 2 tablets 3 times in a day. Then Arogya Vardhini, the best rasayana for liver. This is the best liver tonic. 2 tablets 3 times in a day. Then Amruta Bhallataka Valleha, 1 teaspoon each morning. But as it contains the Bhallatak, very careful. If there is a very active bleeding, don't use Bhallatak. Bhallatak is contraindicated for bleeding. Bhallatak is contraindicated in Pitta dominant Prakriti or Pitta dominant diseases. Bhallatak should not be given because it is also having Ushna, Tikshna, hot and penetrating property. Then there is a laxative, Gandharvaritaki Churna, 1 teaspoon at bedtime with warm water. Then what you can do for the local application for the dry piles, apply Sarj Ras Malahar or Shat Dhauta Ghrita locally. Then fumigate Dhupana, Dhupana Chikitsa with Gugulu, Vacha, Dhup, Ova, etc. Apply Chukratail and advise Avagahasved, that is sitz bath or the tub bath. We have discussed dry piles, Shushka Arsha in Ayurveda. Now we will go for the bleeding piles. So let us see what can be prescribed to the patient for the bleeding piles. In Shushkarsha, Kankayana Guti was there. In bleeding piles, Raktarsha, Bol, Badharas, available with Baidyanath and Amazon, 2 tablets 3 times in a day. Then, what is that? Samshakara Churna. Samshakara Churna. Huh? Can you see that? Sama Sharkara Churna. Sama Sharkara Churna. Sama Sharkara Churna. It is tablet form or powder form, 2 tablets 3 times in a day, or not, then half or 1 teaspoon 3 times in a day. Then Triphala Churna or Triphala Ghanavati, both can be given 2 teaspoon at bedtime with ghee and warm water for the normal stools. Then Praval Vati or Praval Pishti Vati, because it is bleeding. So this is a hemostatic according to Ayurveda, 2 tablets 3 times in a day. Kam Dudhavati, Antipitta, Pitta Shamak, 2 tablets 3 times in a day. What is the HP? Hari Parshuram Aushadhalay Pharmacy of famous late Khadiwale Vaidya from Pune city, Maharashtra state, India. Okay. Kutajarist, 4 teaspoon with equal amount of water after meals. Or another prescriptions are there. For example, you can use Himalaya Company Pylex tablet, 2 tablets 3 times in a day. You can use Baidyanath Pyroids tablet, 2 tablets 3 times in a day. Or you can use Charak Arsho Nil, 2 tablets 3 times in a day. Or you can use Naga Keshara Churna, 1 teaspoon with butter and warm water 3 times in a day. For local application, Shatadhauta Grita and Pylex ointment is there, Arshonil ointment is also there. We are talking about bleeding piles. Pathya Pathya. Use the Surana and Takra is advisable in Shushka Arsha. Shushka Arsha. If excessive bleeding, don't use Surana. Don't yam, don't use. In spite of, take black raisins, 30 to 40 each time, or 10 to 15 each time, and 2 or 3 times in a day. Old rice, then wheat, takra, buttermilk, shuntha, dry ginger powder, then padvala, etc. good for the piles. Stay away from spicy, hot food and curd, that is fermented products. Sitting on uneven surface or in the same position for long time is bad. Riding on a bike on the rough road is also traumatic. Then forcible bowel movement, pravahana, absolutely avoided. Now we will talk about the different another problem for rectal bleeding. Let us see these 2 things. Cancer of the rectum, refer the patient immediately to the Ayurvedic consultant or modern oncologist. Amoebiasis, please see my another video of pain in abdomen where I have discussed this amoebiasis. Next problem is parikartika, that is anorectal fissure. In Ayurveda, the word is parikartika. Chandrakala ras, 2 tablets 3 times in a day, antipitta. Mauktik Kamadudha is also pitta shamaka, 1 to 2 tablets 3 times in a day. To get a normal stools, proper defecation, abhayarishta, 4 teaspoon with equal amount of water 2 times after meals, so that they can avoid you can avoid the straining. Local application, Shatadhauta Grita or Kailas Jivana, Jatyadi Grita or Jatyadi Tail can be used. It is better to consult a specialist if no improvement is noted. Next problem for rectal bleeding is perianal hematoma, blood clot. Tifla Guglu, 2 tablets 3 times in a day. Gokshuradi Guglu, 2 tablets 3 times in a day. Anti-inflammatory in Ayurveda and also Rasayana. Vat Vidvamsana analgesics from Ayurveda, 1 tablet 3 times in a day. For local application, the Dashang Lep paste can be applied. Okay. Then mostly it is a last problem of today's discussion, but we will see abscess, that is perianal abscess. In Ayurveda, it can be called as a Vidradhi. Vidradhi. Okay. Sukshma Triphala, broad spectrum Ayurvedic antibiotic, Sukshma Triphala and Gandhak Rasayan. I am used to tell you for many videos, 2 tablets 3 times in a day. This is Sukshma Triphala is available from Ayurveda Rasashala Company, Pune City, Maharashtra State, India. Gandhak Rasayan from Baidyanath, Amazon, 2 tablets 3 times in a day. Septilin from Himalaya Company, 2 tablets 3 times in a day. Triphala Gugulu, analgesic, anti-inflammatory, 2 tablets 3 times in a day. For local application to burst to natural incision and drainage, not surgical. Leper body can be applied. Now, with the treatment, if there is a pus in the abscess, incision and drainage is a better choice. If no facility is available with you, better refer to the surgeon. For any kind of per rectal bleeding, use following symptomatic treatment. Any bleeding. Chandrakala Rasa, 50 milligram. Pravala Bhasma, 50 milligram. Mauktika Bhasma, pearl, very thanda, cool, 50 mg. Amalaki Churna Rasayan as well as hemostatic, 500 milligram. Nakkesha Churna, 25 milligram. 3 times in a day. Mix all these things and take the 3 times in a day this particular mixture. Regimen for any bleeding, better way, head low position and abdominal ice packs are very useful in any cases of per rectal bleeding. So my dear friends, in this particular video, Professor Dr. Rajendra Deshpande has discussed about the per rectal bleeding. So to see all the videos of these series, Ayurveda in GP, please check my playlist. There is a playlist which is called as a Ayurvedic treatment for many diseases. So you see each and every video many times and you will be very confident for your medical practice. Thank you very much for your cooperation. Please don't forget to subscribe my YouTube channel and make lot of comments to boost my energy. Thank you very much. I wish all the best. Take care.